Hello everyone, welcome to my channel The Courageous Nurses. So today we are going to talk about the penile cancer. Coming to the introduction of penile cancer is rare, occurring in less than 1% of cancers among men in the United States. It accounts for an estimated 1,290 new cancer cases and 300 expected deaths each year. The 5-year survival rates for cancer localized to the penis approaches 80%, but this statistic drops to 52% if the lymph nodes are involved and to 18% if the cancer has spread beyond the inguinal lymph nodes. Penile cancer is much more common in some parts of Africa and South America, where it accounts for up to 10% of cancers in men. Because the penis contains different cell types, penile cancer can arise in each type of cell, which determines the prognosis. Definition of the penile cancer says penile cancer is a disease in which malignant or cancer cells form in the tissues of the penis. Here the picture has been given the anatomy and physiology of penis. So to give you a very brief idea about it, that you can see that how the penis, it consists of the connective tissue, urethra, corpus cavernosum, corpus spongiosum, blood vessel, dorsal nerve, everything is present, and how the penis is divided into base, shaft, glans, foreskin. The basic physiology of penis is it is mainly helpful in urination and ejaculation of sperm. As we are going through a systematic way, so we will see the types of penile cancer. First, we mainly have 4 types of penile cancer. The first one is the squamous cell carcinoma. 90% of penile cancer is epidermoid or squamous cell carcinoma. When cancer begins in squamous cells, it is called a non-melanoma skin cancer, and it can develop anywhere on the penis. Most develop on or under the foreskin. When found the early stage, epidermoid carcinoma can usually be cured. Coming to the second type, basal cell penile cancer. Under the squamous cell in the lower epidermis are round cells known as basal cells. These are occasionally become cancerous. This is called a non-melanoma skin cancer. Less than 2% of penile cancer are basal cell carcinoma. Coming to the third type of our penile cancer, that is melanoma. The deepest layer of epidermis contains scattered cells called melanocytes, which produce the melanin that gives the skin color. Melanoma starts in melanocytes, and it is the most serious of the skin cancer type. The cancer occasionally occur on the surface of the penis. About 2% of penile cancer are melanoma. Coming to the fourth type, sarcoma. About 1% of penile cancer are sarcoma. This is the cancer that develop in the tissues that support and connect the body, such as blood vessels, smooth muscles, and fats. As we are looking into the cancer, so we should also know about the various stages of penile cancer. Mainly we have got 5 stages of penile cancer. Stage 0, abdomen cells are found on the surface of the skin of the penis. These abdomen cells may become cancer and spread into nearby normal tissues of your penis. In stage 1, cancer has formed and spread to connective tissue just under the skin of penis. In stage 2, cancer has spread to connective tissue just under the skin of the penis to one lymph node in the groin or erectile tissue. Stage 3, cancer has spread to connective tissue of the penis to more than one lymph node on one or both sides or urethra or prostate. In stage 4, cancer has spread to tissue near the penis and lymph node of the anywhere or near the penile area. As you can see the various causes, here you can see I have given book picture and patient picture because this was a case presentation for me. So therefore I have just given a comparison. But you can see the book picture. In book picture, what are the various causes which you can find because of which penile cancer can happen. Mainly it is idiopathic. There is no known case, there is no known cause, but the various risk factors can be have the human papilloma virus, that is HPV, if the person has got, if being age over 60 years. So after 40 years the chances increases, and after 60 years the chances of having penile cancer, it increases more. Then the person having any smoking habit, have a weakened immune system because of HIV or AIDS. The other various risk factors are no circumcision is done. Circumcision, it is mainly the removal of foreskin. Then the next one is phimosis. Phimosis, it is the hardening of the foreskin. Had psoriasis treatment with the drugs Sorilene and ultraviolet light, having multiple sexual partners, using tobacco, poor personal hygiene. As you can see, I have given a picture of pathophysiology. Here the entire gland, shaft and body is presented. Penetration of buccal fascia and the tunica albuginea allows for infiltration of corpus caverosum permeating the lymphatic system. The lymphatic system, it will spread to the superficial inguinal lymph nodes, which will lead to spreading of the cancer cells. Lymphatic system to the deep inguinal lymph nodes, it will go, and you will see in most of the penile cancer the lymph node is also affected due to the lymphatic system, and because of this lymphatic system it will spread more, and it will also go and metastasize to occur in lung, liver, bone and brain. Coming to the various signs and symptoms, you can see changes in skin thickness or color, as we have already talked about the phimosis, that is the hardening or thickening of your foreskin. Then a rash or small crusty bumps on your penis can be seen. It can look like an unhealed scab. Growth that look bluish brown, a lump on the penis, a bad smelling discharge underneath your foreskin, a painless sore on penis which may bleed. Swelling at the end of penis, lumps under the skin of groin, blood coming from the tip of penis or under foreskin, unexplained pain in the tip of penis. So coming to the diagnostic evaluation, we have to do the history taking, physical examination, and obviously we should also be seeing the CBC and serological report of the patient. Biopsy we should be doing, taking the tissue of the affected area, fine needle aspiration, sentinel lymph node biopsy to see whether the lymph node is affected or not. In most of the cases lymph node is affected, so we have to remove the lymph node as well. DRE, digital rectal examination, it is mainly done if there is any prostate problem or any penile problem. That time we mainly go for DRE. X-ray, USG and MRI we should be doing for such kind of conditions. The various treatment for penile cancer are: for surgery, partial penectomy with bilateral pelvic lymph node dissection. Circumcision, it is mainly removal of the foreskin which has been hardened because of the disease condition. Simple excision, it means that there will be removal of the tumor with the surrounding tissues and not affecting the normal tissues. In Mohs surgery, microscopically controlled surgery, it is also said. In this operation, what will happen? This may be an option instead of wide local excision in selected cases. Using the Mohs technique, the surgeon removes a layer of skin that the tumor may have invaded and then checks the sample under microscope right away. If it contains cancer, another layer is removed and examined. This process is repeated until the skin sample does not have any cancer cells in it. Glandsectomy. If the tumor is small and only on the glans, the tip of the penis, part or all of it may be removed. Skin grafts may be used, rebuild the glans after surgery. Then partial or total penectomy, there will be removal of the part of the penis or total penis. In lymph node surgery, men with cancer that has grown deep within the penis, especially in case of stage T2 or higher, usually need to have some nearby lymph nodes in the groin removed so that they can be checked for cancer spread. In sentinel lymph node biopsy, it is also said as SLNB. This operation can sometimes help the surgeon see if the groin lymph nodes contain cancer without having to remove all of them. It's most often done when lymph nodes are not enlarged, but there's a chance that the cancer can reach to them. Then inguinal lymphadenectomy. Many men with penile cancer have swollen groin lymph nodes when they are first diagnosed. As I have already mentioned before, these lymph nodes need to be removed if they contain cancer cells, but sometimes the swelling is mainly from infection or inflammation and not because of cancer. So in such kind of cases, doctors mainly give antibiotics to such patients. Pelvic lymph node surgery. If cancer is found in two or more inguinal lymph nodes, pelvic lymph nodes will also be removed and checked. This may be done at the same time the groin nodes are removed or later as a separate surgery. This surgery is done through an incision in the lower belly. The risk of lymphedema goes up if these nodes are also removed. In another type of treatment, we have chemotherapy, where we mainly give bleomycin, cisplatin, or methotrexate. Then we have photodynamic therapy. It uses laser or other light sources combined with a light sensitive drug to destroy abnormal cells. The last is your radiotherapy. In radiotherapy, it treats cancer using high energy rays to destroy cancer cells while doing as little harm as possible to healthy cells. These are the various nursing management, as we should also see the nursing diagnosis. So these are the various nursing diagnosis. Acute pain related to surgical procedure as evidenced by verbalization, facial expression. Fatigue related to low hemoglobin level as evidenced by reduced daily activities weakness. Constipation related to insufficient activity, environmental changes as evidenced by infrequent passage of stool. Risk for electrolyte imbalance related to dehydration as evidenced by generalized weakness. Risk for infection related to surgical procedure, catheter in situ as evidenced by high WBC level, insufficient knowledge regarding wound management. The various complications which we can see are seroma, lymphocyte, anemia, flap necrosis, wound infection or necrosis. Thank you for watching my video. I hope you have learned something and it will be very useful for you. Do like, share and subscribe my channel. Thank you.